Hello everybody, today I'd like to talk about why psychedelic drugs should be legal for medical use in the United States. When you think of drugs like acid, shrooms, or Molly, I'm sure you don't associate them with doctors, but rather with hippies and partying. Surprisingly, these drugs, plus many other psychedelic substances, have a huge role in today's medical field. I'm sure you may be apprehensive at the thought of a doctor handing out these drugs as medicine, but I promise you they have more medical purposes than you think. Let's take magic mushrooms as our first example. The psychoactive substance in it is called psilocybin. The chemical has been proven to help treat existential distress in cancer patients. Mushrooms are also highly effective at treating cluster headaches. An article on maps.org interviews Dr. Rosenberg, who's the director of the Johns Hopkins Headache Center. He explains that it is hard for him to tell a patient that psilocybin may treat their cluster headaches because it's not technically legal. Although not as well known, a drug called ibogaine is a Schedule I drug in the United States. This means that it is a high potential for abuse and no medical use. The psychedelic substance is in fact legal medically in many countries. According to WebMD, ibogaine can be used to treat fever, flu, high blood pressure, and most commonly treat substance abuse. People going through treatment for substance abuse will sometimes go to countries where it's illegal to receive ibogaine treatments, and I'm sure you can imagine how scary it would be to have to travel that far just to get the help that you need. The last psychedelic drug I'm going to talk about is MDMA. This is commonly known as Molly or ecstasy. Though it's mainly associated with partying and raves, the substance has a great medical possibility. According to thelancet.com, active doses of MDMA with adjunctive psychotherapy in a controlled setting were effective and well tolerated in reducing PTSD symptoms. It's also used with treatment of anxiety, depression, and addiction. A common fear of these drugs being legalized is that people may pretend to have an illness in order to receive these drugs. A great deal of patients would actually be using them with therapy and medical supervision. Now, as for the users who do get to take the drugs home, that's just the risk that we have to be willing to take. There are so many medications that doctors currently give out with a high risk for abuse. Some of the medications include Oxycontin, which when abused gives effects similar to heroin, and Adderall, which has similar effects to methamphetamine. So both of these medications are highly addictive, whereas psychedelic drugs are typically not. So if the benefits outweigh the risks when it comes to those, then why can't it be the same for psychedelics? Now you may find it hard to imagine a future where these drugs are given out by doctors, but 20 years ago, it would have been really hard to imagine marijuana being given out by doctors. Now, marijuana is actually legal in 33 states medically and 10 states recreationally. Do you really think it would be hard to legalize psychedelic drugs medically if states are already legalizing marijuana recreationally? Let me remind you, marijuana is also classified federally as a Schedule I drug. I have a strong feeling that some of these drugs will be legal for medical use in my lifetime, and I hope that I may have changed your view on a controversial topic. Thank you for listening.